Hi, my name is Gabriela Davila. I'm a nurse in San Antonio, Texas at Metropolitan Methodist Hospital in Surgical Services. And this is my video presentation of my nursing teaching plan for my nursing and leadership course through West Texas A&M, where I am currently seeking a bachelor's degree through their RN to BSN program. The teaching need that I had identified on my unit in particular was the need for more patient education in Spanish to our Latino community, which is a big community that we serve here down in South Texas. And I focused on laparoscopic cholecystectomy since it is the most commonly performed procedure that we do in our facility. I identified this need by really focusing on our community and what I saw most frequently as a barrier in as a native Spanish speaker, and that being my first language, I saw that often we would get patients into the area who did not really have a good comprehension on what procedure they were having done. Because of the language barrier, a lot of the times I believe that the patients were getting the minimum information just to do an informed consent, but not really being educated as they should be. So I focused my teaching plan for this, and like I said, I picked laparoscopic cholecystectomies because it is the most common procedure that we do. So when researching for my tools, I came across the American College of Surgeons. They have created a tool about cholecystectomies in particular, and they have translated that tool. I went over it and reviewed it, and it is most commonly aligned with the teaching that we already currently do in our facility. So I decided to use that as my teaching tool. Plus, it had pictures and diagrams and a QR code for more information. So I really liked that. They had those resources for the patient. So on my unit in the surgical services and on the inpatient unit is where the patients that I identified were being educated. If I had the availability to meet with a patient that was Spanish speaking the day prior to surgery, I took advantage of that. If not, I would meet them in the surgical area, holding area where we prep for surgery. And then also, this information was distributed to our high surgical floors, our med surg floor, and then a couple of other floors that frequently have patients coming down for surgery. And they were provided with the tools as well. We do currently in our facility use the AMN language services. So we use a two-way video for translation so that the patient and the interpreter can meet and greet each other and speak to each other directly with the hospital staff. I encourage the nurses who were not primarily Spanish speaking to use that tool to educate their patients and also to help answer any questions if they were Spanish speaking, because sometimes, even though you're a native Spanish speaker, you might not be able to thoroughly answer a question if you don't have all the information. So I always encourage the use of a translator if needed. So the what I did was I created a couple of colored copy sets of the education, and I kept these on the unit and in the surgical services department. And that way we could use them with the patients and reuse them. So wipe them down with the sandy wipes and then reuse them at a later time so that we were cost effective with our education. But also, if the patients would like a copy of this, we would print out a black and white copy to put in their chart for discharge. I'll bring out that tool again later once I go over how I did my teaching. So I will walk you through my presentation that I would do with the patient, kind of in a shortened version of it and in English. This presentation I always did in Spanish. So I would always kind of start by identifying the patients that I believe could use the service, and then I would introduce myself to them. Hola, me llamo Gabriela, soy su enfermera en la área de preparación para su cirugía. So I would tell them my name. I'm a nurse from the surgical services department preparing you for surgery. I would then ask them their patient identifiers, name and date of birth, que su nombre y su fecha de nacimiento, Once they would give me that information and I knew I was talking to the right patient, I would then ask them about what they knew about their surgery. And most of the time, I found that patients understood that they were having their gallbladder removed and that it was going to be with small incisions, but nothing more than that. So I would bring out my education tool. I would ask them if they were comfortable with me reviewing it with them. And we would kind of start from there. I really liked this tool because I feel like it had a lot of good information, starting with the condition of cholecystectomia, which is the cholecystectomy. So condition, symptoms, lots of diagrams and pictures so that they could understand what we were talking about, options for treatment, including non-surgical options, benefits of surgery, and then expectations on this front page. Second page listed more information about conditions, the types of procedures or tests performed prior to diagnosing the condition. And it did have another area that was a small area about cholecystectomy or cholecystitis in children, which I did not commonly review because we do not work in a pediatric unit. Uh, it went over on the third page, treatments, surgical treatments and non-surgical treatments. So laparoscopic gallbladder removal, open cholecystectomy, and then non-surgical treatment. It had risks based on calculated information from the American College of Surgeons. This in particular was interesting because it had complications from pregnancy. And we actually, in our area, frequently saw patients who were pregnant very early on in their pregnancy, first to second trimester, having their gallbladders removed as well. And these patients in particular had lots of questions in regards. So I think this information was pertinent to them. On this next page, it went over expectations. So, how to prepare for surgery, medications, anesthesia, on the day of surgery, what to bring, what to expect, fluids and anesthesia after surgery, prevention of pneumonia and blood clots, which I think is super important for any surgical patient. Recuperación, so recovery and discharge, talked about nutrition, rich in fiber nutrition. It talked about activities, when to return to work and school, and also how to take care of your surgical sites. Um, and also when to reach out and seek medical attention, which I think is very important. We do always provide our patients with surgical site infection fact sheets, but I really like that this tool went into that as well. On the next page, we have pain control. So I think this is really important for patients as well because it goes over therapeutic and medications and non-pharmacological therapies to help pain control as well. And then on the last page, it had the glossary for some of the big words or big information. I think that broke it down really nicely. And then it had this QR code at the end with more references if needed for the patients. Like I said, the patients were educated on this after I would go through this with them. I would ask them if they had any questions, review this if I could as a reference. And then if they had any questions for the surgeon, I would make sure that those questions would get relayed to the surgeon and answered before the patient signed informed consent and gave their permission for the surgery. I believe that this teaching plan really helped a lot of patients in my area really have the understanding for the surgery that they were allowing us to do on their bodies. So it gave the patients a lot of autonomy, and I was very grateful that a lot of the patients were open to my teaching plan. Thank you for your time.